Now, today we will be going through some of the image-based questions which are asked from anatomy and which are highly liable to be asked in future as well. So these are the image-based questions, high-yield topics, and these are likely to be asked in your future examinations as well. So going to the first question, you can see the screen and I will enlarge the screen for you. A 55-year-old male fell from stairs. He had polytrauma. He became unconscious and was brought to the OPD. The CT scan was done, which is shown below. So you have the image of a CT scan, and the question reads as the man fell from the stairs, polytrauma, and the the figure over here shows left STH. So if you see the question, have a look at the figure left STH. Now the most likely cause is. So now you have not to make a diagnosis, you have to mention the cause of this STH. Rupture of middle meningeal artery, anterior division, rupture of middle meningeal artery, posterior division, rupture of internal carotid artery near foramen lacerum, rupture of the veins. Now, if you see, combine your knowledge of anatomy, surgery, radiology, you are aware that there are three types of hemorrhages, and one is the EDH, second is the STH, and third is the ICH. So EDH, extradural hematoma or epidural hematoma. The STH, the subdural hematoma. The ICH, the intracranial hemorrhage or the parenchymal hemorrhage. So EDH is extradural, outside the dura, or epidural, upon the dura. STH is subdural, beneath the dura, and intraparenchymal or parenchymal is within the substance of the brain. So the three different sources. Parenchymal hemorrhages can be due to bigger vessels, anterior cerebral, middle cerebral, or posterior cerebral artery, or their branches. Now, you have to distinguish between two things, EDH and STH. As far as EDH is concerned, I have already told you that extradural hematoma or epidural hematoma occurs usually due to the damage to the area of the pterion, which is an area corresponding to the exterior of the skull, and inside it are the markings of the middle meningeal vessels on the inside of the skull. So extradural hemorrhage or extradural hematoma is a result of middle meningeal artery rupture. But the STH, so subdural hemorrhage, is a result of tear or rupture of the veins. So very important question, the asking the basic etiology of SDH, and here the correct option would be option D, rupture of the veins. Very important. So in here you have to just remember the explanation. I have provided you the explanation. Remember what I have told you, and that settles the issue for your lifetime. That's important. Now, a sagittal section on interior shows ventricular system. So you are given the figure of a ventricular system. The communication between lateral and third ventricle is shown. It is called as, so over here, this is the area of the lateral ventricle, which I am just denoting with my cursor. And then this is the area of the third ventricle, and this is the area of the fourth ventricle. The question mentions the communication between lateral and third ventricle is shown. So this is the communication where my pointer is called as the foramen of Luschka, foramen of Winslow, foramen of Monro, foramen of Magendie. So a simple concept-based question, because there are this, you have to remember, there are these eponyms in anatomy, that there are certain important foramina named after certain people, after certain dignitaries, and certain foramina given the name as such. So you are well aware of foramen ovale, foramen spinosum, foramen, I mean to say magnum, jugular foramen, foramen of Winslow, foramen of Monro, which is mentioned over here. But over here, the question specifically tests your ability to know the communication between lateral and third ventricle. As far as your profound knowledge of neurophysiology, neuroanatomy is concerned, neurosurgery is concerned, you remember that the area between the lateral ventricle and the third ventricle is guarded by a foramen which is given the name as interventricular foramen, and that is named after Monro, because the CSF, the bulk of the CSF is produced by the choroid plexus of the lateral ventricle and less so by the choroid plexus of the third ventricle. So the CSF, which is found major activity of it in the lateral ventricle circulates to the third ventricle through the interventricular foramen Monro, and from the third ventricle the CSF goes down into the fourth ventricle, which is a space over here between the cerebellum behind and the pons and the medulla in front. And this third ventricle to fourth ventricle communication is the cerebral aqueduct. To be more specific, the cerebral aqueduct of Sylvius. So interventricular foramen of Monro, cerebral aqueduct of Sylvius are the two foramina connecting the lateral ventricle to the third ventricle and third ventricle to the fourth ventricle consecutively. And in the fourth ventricle, we have got the foramen of Magendie and the foramen of Luschka. So you have to remember those things. The foramen of Winslow is also the epiploic foramen between the lesser sac and the greater sac. No, I mean to say, relation over here. So the answer to the question over here is the interventricular foramen Monro between the lateral and the third ventricle. I hope that you remember this thing, the circulation of the CSF and various other conditions which are as a result of surgical entities like choroid plexus papillomas and the pineal tumors and other tumors which can obstruct the flow of the CSF and cause a ventriculomegaly, the enlargement in the size of the ventricles of the brain, a topic which I will not discuss over here. That is for your specialty and higher courses. But remember the basic anatomy, basic surgical anatomy, that's it. Now, moving to the other question. The figure shows hypothalamic area. So this is the area of the hypothalamus and mammillary bodies are shown, seen. A lesion in the mammillary bodies causes. So this is the mammillary body, multiple of them called mammillary bodies, and a lesion in the mammillary bodies causes Huntington's chorea, Sydenham's chorea, ataxia telangiectasia, Wernicke-Korsakoff syndrome. So now this important image-based question tests your ability to know what lesion is caused as a result of dysfunction or damage to the mammillary bodies. So this is very important. Mathematical neuroanatomy is mathematical. A lesion in some area will cause a specific, damage, and you have to remember that. Now, as far as the different areas of the the brain or the CNS are concerned, you get different lesions as a result of damage to these different areas. Now, you have those basal ganglia, and the damage to the basal ganglia would cause damage of the movement because basal ganglia are concerned with the movement, regulation of movement. So they will cause something like chorea and athetosis, a topic which I will not discuss over here. Then you have got some areas like substantia nigra, which again will be causing movement disorders. But as far as the specific question goes here, mammillary bodies, the mammillary bodies are shown here, and mammillary bodies cause the damage to the mammillary body is usually caused in chronic alcoholics because of excess in alcohol intake as a result of vitamin B1 or thiamine deficiency, which occurs biochemically in those conditions and certain other conditions. So Wernicke-Korsakoff syndrome is a subset of, conditions having a range of symptoms, classically a triad of acute confusion, ataxia, and ophthalmoplegia. And you have to remember the association of mammillary bodies to the causation of Wernicke-Korsakoff syndrome as a result of thiamine deficiency. Huntington's chorea and Sydenham's chorea are diseases as a result of damage to the basal ganglia, whether it is the caudate nucleus, the lentiform nucleus. Ataxia telangiectasia is a pure neurological entity along with Friedreich's ataxia, which has a different etiology. So here remember mammillary body and Wernicke-Korsakoff syndrome. That is very important. Now, another image-based question, very, precise diagram, a high definition diagram of stellar process is shown. The structure related medially to it is. So it is a question based on anatomy, the relations. You get certain types of questions sometimes like this. Parotid gland, whether it lies medially, ramus of mandible, whether it lies medially, internal jugular vein, or zygomatic arch. Now, important is that you have to remember the stellar process, basically not a stellar process. We give it the name as stellar apparatus because stellar process it gives attachment to many muscles, many ligaments, and I will enumerate them just now. But sometimes this figure arrow shows a short styloid process, though sometimes we can have a very long elongated process, a clinical entity known as Eagle syndrome. Remember that, by the way, this came to my mind. And then this is short styloid process, and you remember that this styloid process is related medial. The medial relation to the styloid process, a very important vascular structure, and that is the internal jugular vein, because parotid gland will be lying laterally or to the styloid process, and the apex is related to the ramus of the mandible. So the ramus of the mandible is related to the apex, and laterally, as I mentioned, the parotid. The medial relation is the internal jugular vein. And just not to forget other things about the styloid process, you have to remember that the styloglossus muscle from the styloid process to the tongue, stylohyoid muscle from the styloid process to the hyoid bone, stylopharyngeus muscle from the styloid process to the pharyngeal complex, and then the stylohyoid ligament and the stylomandibular ligament. So these are very important attachments, or sometimes in the examination about the styloid process. But here the question is that the medial relation to the styloid process is the internal jugular vein. So that's a very important image-based question, and I hope that you remember these questions, and this might help you in just getting an idea what are the types of questions asked in your examinations. So this is very important, and I wish you good luck for your exams. Thanks a lot.